private hospitals and nursing homes that constitute more than 80% of doctors in India have been, and 60% of beds have been investing heavily in additional manpower, equipment, consumables, and other resources to ensure 100% preparedness for safety in the healthcare facilities and eventual treatment of patient if needed. Another agency conducted a detailed survey with small and medium-sized healthcare facilities across the country to understand the major challenges and identify areas of interventions needed. Post the lockdown from 24th March, Indian hospitals and nursing homes have seen a large impact, especially among small and medium-sized hospitals and nursing homes, which are now facing existential challenges. The result shows an average fall in revenue by as much as 80%. 90% of the surveyed healthcare facilities are facing financial challenges, with 21% facilities facing existential threat. Hospitals in Tier 2 and Tier 2 cities are experiencing 78% reduction in OPD footfalls and a drop of 79% in inpatient admissions. 90% of organizations surveyed require some form of financial assistance. Now, to discuss about all the position, the problems, and the current position and the impact of COVID-19 on nursing homes, we have a very panel with us, the owners or the chief consultants of the nursing homes. And I would like to start with our first guest. He is Dr. Deepak Jain. He is MBBS, MS, FAIS, FMAS. Dr. Jain is the senior laparoscopic surgeon. He is the chairman of Paras Hospital, a 50-bedded hospital at Ghaziabad. He is the past president of IMA Ghaziabad. Welcome, Dr. Jain, on our show. Now,
thank you, Doctor. Thank you, Mr. Goyal.
Dr. Jain, as you heard, that what the survey says, that there is a less footfall, lots of problems nursing homes are facing because of the COVID-19. But we would like to know from you the COVID-19 impact on nursing homes. Dr. Deepak Jain, please.
Thank you, Doctor. Thank you, Mr. Goyal. Going to the main point, I would highlight two main issues. Number one, the small nursing home and hospitals up to the capacity of 50 beds are the main backbone of Indian medical health providers. As you have already said, that small nursing homes, they provide almost 80 to 85% of medical facility all over the India. And I must congratulate you for the topic which you have chosen, because till date nobody has touched this topic, that how we small nursing homes are facing the challenges, how we will survive in future, and what is our future. So this topic is very relevant, and everybody should focus on our points. Now, I come to your main point straightforward. COVID lockdown imposes major challenges to the small nursing homes. This challenge, I can divide this challenge into 2 to 3 parts. The number one is financial, the most important. And number two is the staff. We face a lot of challenges from the staff. And third, because I'm a follower of Modi ji, the achievement. Certainly we have achieved certain things from this lockdown. And because of the achievement, we are able to survive till date. So I will come first to the last point, that what is our achievement during the lockdown period and how we survive. First of all, as you have said, that we faced sudden financial crunch at the time of starting of lockdown. जैसे ही लॉकडाउन स्टार्ट हुआ, हम लोगों का जो फाइनेंशियल रेवेन्यू था वो ऑलमोस्ट 30 to 40% रह गया। इसके बाद जब अप्रैल की शुरुआत हुई, हमारी जो ऑक्यूपेंसी थी दैट इज ऑलमोस्ट गॉन डाउन टू 30 to 40%, and at the time of distribution of salary and other expenses in the month of April, we found a sudden crunch in the revenue. So God has, किसी तरह भगवान ने भी हमारी सहायता करी। जो स्टाफ हमारा लॉकडाउन की वजह से या तो घर चला गया था डर के, या वो अपने पेरेंटल गांव में वापस लौट गए थे, वो ऑलमोस्ट टू द ट्यून ऑफ 40 to 50% था। तो उसकी वजह से हमारा जो सैलरी डिस्ट्रीब्यूशन और अदर एक्सपेंसेस पार्ट्स थे वो हमारे अप्रैल मंथ में काफी ज्यादा रिड्यूस हो गए थे, जिससे कि ऑटोमेटिकली हम जैसे छोटे नर्सिंग होम और छोटे हॉस्पिटल्स की हम लोग अपने एक्सपेंसेस को मीट आउट कर पाए। लेकिन अब जैसे जैसे टाइम बीत रहा है, हमारी ना तो ऑक्यूपेंसी बढ़ रही है, ना ही रेवेन्यू बढ़ रहा है। जो मेन प्रॉब्लम हम लोग आज की डेट में फेस कर रहे हैं कि पेशेंट सिर्फ और सिर्फ वही बाहर आ रहे हैं जिनको की रियल इमरजेंसी है। इवन जो सेमी इमरजेंसी पेशेंट हैं, दे आर ऑल्सो नॉट टर्निंग अप बिकॉज ऑफ फियर ऑफ कैचिंग कोविड इन्फेक्शन इन द हॉस्पिटल। ऑल्दो माई हॉस्पिटल इज प्योरली अ नॉन कोविड हॉस्पिटल, हमने कभी किसी कोविड पेशेंट को अपने हॉस्पिटल में अटेंड नहीं किया, बट आई एम श्योर दैट ऑलमोस्ट टू द ट्यून ऑफ 2 to 3 कोविड पॉजिटिव पेशेंट्स आर कमिंग in our OPD, and definitely they are producing lot of aerosol for the other patient. Simultaneously, during the period of lockdown and today also, we have to done lot of expenses on sanitization, on producing lot of PP kits during surgery and in ward. So almost the tune of 5 lakh rupees per month we are spending on these issues which were not before the COVID lockdown. आज की डेट में जो हमारा assumption है कि अगर फ्यूचर में 3 से 4 महीने अगर यही स्टेटस परसिस्ट करता रहा, मैं बात कर रहा हूं बाय द एंड ऑफ अक्टूबर, तो डेफिनेटली मैं अपने सेंटर की बात कर रहा हूं कि हमारा सेंटर विल बी इन डिफिकल्ट क्राइसिस एंड वी विल बी फोर्स टू शट डाउन। इसमें मैं रिक्वेस्ट करूंगा सभी तरीके से सभी इंडस्ट्रियल ऑर्गेनाइजेशन से कि वो हमारे इश्यूज को समझें और इन इश्यूज को सॉल्व करने की कोशिश करें, क्योंकि ओवरऑल जो हमारी डॉक्टर्स एसोसिएशन है, जो IMA है, इंडियन मेडिकल एसोसिएशन, he is basically concerned with the doctors, with the welfare of doctors, not with the welfare of nursing homes and small hospitals. हमने पूरे कोविड में मतलब मैं इसे अपना अचीवमेंट मानूंगा, हमने जो भी पेशेंट ट्रीट किए, जो भी हमारे पास पेशेंट आए सस्पेक्टेड कोविड के, जिनको हमने रखा और ट्रीट किया, we were successful in treating those patients as soon as they turn out to be COVID positive. We have referred those patients to the COVID hospital or some government center. But till date, we have not received any sort of help, aid or anything from the government authority. Still, we are happy that we have served our all patients in the duration of lockdown. And I must tell you very honestly that right from the 22nd of March till date, I have taken only 2 days off from my working, and that's too on Sunday. Otherwise, for the period of 4 months, I regularly worked, regularly attended my OPDs, regularly attended my ward patient, and did all emergency surgeries. So over to Mr. Goel.
Okay. Thank you very much, Dr. Jain, for giving the details that according to you, the nursing homes are the backbone of healthcare industry or the healthcare of Indian citizens. And you have mentioned that how much financial constraints you all are facing because of the lockdown. And in spite of that, you have tried to serve the nation, serve the patients without looking back, and you have done it. And you said that you have taken only 2 days off in last 4 months this period. And you have also mentioned that the big industrial house should consider leniently and should help these nursing homes, because according to you, the association like IMA, etc., they only think for the doctors, but they are not thinking about the nursing homes or the small hospitals. Thank you, Dr. Jain, for giving the insight of the nursing homes condition today. Now, I would like to now I would like to go to our next guest. He is Dr. Sameer Bhargav. Dr. Bhargav is the National President of ENT Association of India 2020. He is the professor of HBT Medical College. He is consultant of Hinduja Healthcare Hospital and Dr. R.N. Cooper Hospital, Mumbai. He is the co-author of a short textbook of ENT disease for students and practitioners, which is read by more than 2.5 lakhs students. He was the faculty at more than 70 surgical workshops in the last 20 years. He owns 15-bedded Bhargava Nursing Home at Mumbai. Welcome, Dr. Bhargava, on our show. Dr. Bhargava, you have heard what Dr. Deepak Jain has mentioned. He has mentioned that how the nursing homes are facing financial crisis because of the lockdown, because there is a fear psychosis in the mind of the patients that if they will go to the hospital or nursing home, they may catch COVID-19. And that is why the nursing homes occupancies have gone down drastically. According to him, now they are running only on 30% or 40%, but the salaries and all other expenses are there. Rather, he mentioned that they have to spend 5 lakhs more on the PP kits as well as the sanitizers, etc. So now we would like to know the COVID-19 impact on nursing homes. Dr. Sameer Bhargava, please.
Good morning, Mr. Goel, and thanks for having me on this show. So, well, as Dr. Jain has mentioned, the scenario at his place. So I would say that we are all in the same storm, but yes, all in different boats, small boats, larger boats, but all of us are in the midst of this storm. So both Mumbai and Delhi were affected very early in this. So the impact of the COVID scenario on not only patients, but the entire healthcare system on the nursing homes has been maximum right from the beginning in Mumbai. So the lockdown which came up on the 24th of March greatly impacted many things. See, the demographics in Mumbai is such that lot of our staff is staying very, very far away suburbs. And to commute to the place of work requires the use of the public transport, which is in the form of trains or buses. And these right from the beginning, because of the lockdown, could not function. So the challenges that one was facing was that number one, that patients, of course, were scared everywhere because the entire scare was only urgency. Only the urgent cases were attended to, and all, even the important or semi-important, took less precedence. So the patients decided that, well, it is too risky to go out, and that is why the footfalls at the hospitals, at the nursing homes reduced substantially. Now, as you earlier mentioned, that more than 80% of the healthcare system is actually borne by the smaller hospitals, nursing homes, etc., other than the government setups. So these form a very important backbone. But the hospitals, nursing homes are run not only by doctors, they are run by the supporting healthcare staff also. And if the staff is not able to reach, it is very difficult to be able to run the 3 shifts regularly. So my nursing home is more of a surgical facility. And because, as I said, that only emergencies were taking precedence over even urgent or semi-urgent, so the occupancy of the nursing homes who are catering more to surgical work went down by as much as, I would say, 80 to 85%. The OPDs continue to function. I must congratulate Mr. Jain for having right through worked through. So also a lot of nursing home owners and physicians in Mumbai also continue to run their OPDs. Of course, the number of patients that were coming were definitely lesser, but we continue to run our OPDs because besides COVID, there are other ailments also that patients have, their chronic ailments, and those unfortunately, if neglected, are going to land up with bigger problems in the future. Thanks to telemedicine, which the government introduced very early in March itself. So a lot of I would not say a lot of workload, but a little small part of the workload was reduced also because of the telemedicine that we started doing. Now, this was the scenario in the month of the second part of March and also April. But from May onwards, I found that the slight increase in the number of patients, particularly in the OPDs, which earlier were probably, as I said, 15 to 20% only, gradually increased to at least about 30-35%. And today, in the month of end June and July, I find that at least 40 to 45-50% of patients are coming to the OPDs to attend to their semi-emergencies or urgent ones. The chronic ailments, they are still refusing to come. We have very slowly started some semi-emergency surgeries also, not only. So earlier it was only, since I'm an ENT surgeon, it would be more of things that would be impairing their airway or their swallowing passage or things like epistaxis, etc. But today we find that the patients are coming forth saying that, well, we feel that this whole scenario will continue at least for another 2 to 3 months. We would not want to postpone everything indefinitely. So they are starting to come. But yes, it has been a huge financial impact and to a large extent even a psychological impact to the staff. Because at one point my staff did ask me, Doctor, agar ye aise hi chalta raha, how will we work and survive in the months to come? But yes, in adversity comes out all the challenges and how you cope up with that. So gradually we are now coming to terms with the fact that yes, this COVID-19 is here to stay in a major way, at least for the next couple of months, and gradually over the next few months and maybe even up to a year, we will continue to function. We have devised ingenious ways of trying to not only save and protect our patients, but also the hospital staff, taking all the due care which we require so that the staff itself should not catch infection. So the cost on all these safety devices, precautions has increased the financial burden to the nursing homes, at the same time dealing with a lowered revenue.
Okay. Thank you, Dr. Bhargava, for giving the details. And you have also mentioned that the revenue has come down and the expenses have increased. And you have also mentioned that initially when the lockdown was started, only those with emergency conditions were coming to the nursing homes. But now people have realized that this thing may continue for some more time. So all those who are not in that acute condition, but still they want the surgery, so they are started coming. But still the picture is not clear because the expenses are far more for the safety of the staff and for the safety of the patients, and the revenue is down. And that's why all the nursing homes and the hospitals, the small hospitals, are suffering a lot. Now I would like to go to our next guest. He is Dr. Praveen Goyal. Dr. Praveen Goyal owns Gopi Krishna Hospital, Mathura. He did his graduation training from UCMS and GTB Hospital, Delhi. Post-graduation training from Rajawadi Hospital, Mumbai. He did his fellowships in Mumbai. He also did observership in joint replacement at Princess Alexandra Hospital, England. Gopi Krishna Hospital is the only private hospital in Mathura to be NABH accredited. He is treasurer of IMA Mathura. He is also the joint secretary of Nursing Home Association, Mathura. Welcome, Dr. Goyal, on this show. Dr. Goyal, you have heard what Dr. Jain and Dr. Bhargava has mentioned. And both have mentioned one thing very clearly, that because of this COVID-19 impact or the lockdown, their revenue has come down drastically. The expenditures have increased because of the safety precautions which the nursing homes are taking for the patients as well as for the staff. And according to them, because of the fear psychosis, it's very difficult that the patients are, because the patients feel that until there is very much urgent, they don't want to come to hospitals or the nursing homes because they feel that they may catch the infection. But now, because the nursing homes, which according to Dr. Jain is the backbone of the healthcare system, as well as Dr. Bhargava has also insisted that if we will only concentrate on the COVID-19, then what will happen to the other diseases which are also very, very important. Now, we would like to know the COVID-19 impact on nursing homes. Dr. Praveen Goyal, please.
Thank you very much, Goyal, sir. Problems of Tier 2 cities and Tier 1 cities are a bit different. What Dr. Sameer sir and Dr. Jain sir have told us, they have told us from a perspective of big cities. But in cities like Mathura, we are facing financial burden, but our problems are different than what they are facing. So like when the lockdown was initiated earlier, then there are about 75 to 80 hospitals in Mathura. All the hospitals were closed by the administration, and only 7 hospitals in whole of Mathura were allowed to run. Our hospital was among those 7 hospitals. So now you can imagine what 75 hospitals burden was prior to lockdown. That whole burden came to only those 7 hospitals. So initially we were facing a lot more patients. We had to deal with a lot more patients than we were used to before lockdown. So now we had to enforce social distancing, and it was such a problem for us because patients were in large numbers, staff was less. So what we had to do, we had to enforce strict social distancing. We were not able to. So almost on a daily basis, fights were happening in hospitals. Then probably staff and patients are more sensitized about social distancing and sanitization and mask in big cities. But in cities like Mathura, I do not think patients and staff are that afraid of corona. I see many patients in my hospitals who are not wearing masks. And when we request them to wear masks, they say in their Hindi local language, ki mujhe se corona ho raha hai kya tumhe? So those sort of problems are probably not there in Delhi and Mumbai, but we are facing those problems. Then, one problem is what will happen to the nursing homes who have only specialities like gynec and ortho. We are not physicians, we are not general surgeons. But now the administration has closed all the other hospitals. So those patients, when they come to us, they ask us to treat the ailments which we are not qualified for. So that becomes a problem for us. Now refusing the patients and then the patients going to complain to administration authorities, that is another problem. Sir, then there was one more problem, that suppose if a COVID positive patient comes out from a hospital, then the administration threaten us to seal the hospital. So these sort of problems we used to face a lot, but now since the lockdown has eased down, so now these problems have been mitigated, but still social distancing, asking and requesting patients to wear masks, that is still a lot of headache here.
Okay. Thank you, Dr. Goyal, for giving the details. And you have mentioned very clearly that there is a lot of difference between metro or big cities and the tier 2 cities. And you say that because you are from Mathura, the conditions there is entirely different than the big cities. And you have mentioned that because the administration have closed all the hospitals initially, and only 7 hospitals were working there, among which your hospital was one of them, the nursing home. And you said that because the patients or the relatives were not keeping the social distancing, they were not ready to wear even the face mask, and they are ready to fight if you insist them to wear the face mask. So when these are the conditions you have faced, and you said that you have faced so many problems, but still you are working, and definitely the financial things. And one more point which you have raised is very valid. You said that the nursing home which is only doing the ortho or the gynec's work, how they can handle other faculties, other like medicine or other general surgeries. So that the administration is not either not aware, or they don't want to understand the practical problem. Now I would like to go to our next guest. He is Dr. Anup Krishna. Dr. Anup Krishna, he is the chief consultant of Anup Ortho Care, an exclusive orthopedic specialty center located in the heart of Kollam district. He is specialized in joints, arthroscopy and arthroplasty. Anup Ortho Care is 20-bedded hospital. He is the member of Indian Arthroscopy Society and Indian Cartilage Society. Welcome, Dr. Krishna, on our show. Dr. Krishna, although I know that you are busy with the patient, which you messaged me, but I will just summarize. Before you, Dr. Jain, Dr. Bhargav and Dr. Goyal spoke, and they said one thing was common among them was the financial burden. Because of the lockdown, the patients have gone down, the number of patients, and the revenue, the expenditure has increased, because for the more safety measures which the nursing homes are taking to safeguard the patients as well as the staff. And because of the lockdown, the revenue from the inpatients and the OPT has gone down drastically. First. Secondly, what Dr. Goyal has mentioned, the tier 2 city like Mathura, he says that here the administration is not understanding that the patients can be treated only where those all facilities are there. They cannot shut all the hospitals, only the hospitals whether it is only doing the orthopedics or the gynec's work. They cannot treat for other surgeries as well as for the medicine patients for the who requires medicines or the physician's treatment. Now, in this aspect, we would like to know from you the COVID-19 impact on nursing homes. Dr. Anup Krishna, please.
Hi, good morning. First of all, I'm really sorry for being late. So first of all, I must tell you, we are going through a bad pandemic crisis, which the world, especially I think our era, has never witnessed such a thing before. And I must express my sincere gratitude to Mr. Goyal for bringing up this topic, because this is often an ignored topic. Most sectors, almost all the sectors have been wiped out by this COVID crisis. And if you ask me what happened, I mean, our practice, I'll divide it into few phases according to the lockdown. So the first case was reported in January, I think, in January in Kerala, in India. That was the first case reported. And within a blink of an eye, within a span of 2 months, before we could take necessary precautions, or before we knew what is happening, we were forced into lockdown. So the first phase was it was a shocking phase. The problems that we faced were, we hardly got any time for preparing. We never had any, we lacked the time for preparation. We didn't have any reserves. All of a sudden, we were finding difficulty. There was shortage of supplies. The staff, all of a sudden, right from March 22nd, where they called for this lockdown, the staff was finding it difficult. Especially the ones from distant places were finding it difficult to come for work. And especially the small bedded a small bedded hospital, 20 bedded hospital, and we have we are going on a brim, like we have a correct patient staff ratio. All of a sudden there was staff shortage and we were finding it difficult to manage things. And another thing, we were unaware about this virus, and the staff also didn't knew, and we also didn't have an idea in the initial phase how to tackle this, the preventive measures that we should take in order to prevent getting exposed to this particular virus. The patient was also confused. And another challenge was the government started taking steps like they started converting the small hospitals into COVID centers, isolation centers. So you can imagine how things will be in a 20-bedded hospital if you start converting if you're reserving 10 beds for the COVID patients. Then I don't think anybody will have the guts to walk into that hospital courageously for getting operated. So that was another challenge which we are facing in the initial phase. And there has been a significant drop in IP as well as OPD department in the initial phase. I am telling about the extreme, the first phase of lockdown that we introduced in March, and it continued almost till April, the midst of April. And that was actually a preparatory phase for us, I must say. We had two options, either to shut down the things completely and or to start resuming our work with conditions so that we won't go into severe crisis. So in the first phase, I think the first phase was the thinking phase. We went into almost hibernation till April 15, and then we reopened and we started working with conditions, like we started restricting our OPDs, we started teleconsultation so that we don't have a direct exposure to patients. We maintained a pro forma in the reception to screen the patients, especially the ones from hotspots and high-risk areas. The staff were given proper training and proper education with the help of government staffs. And then we slowly had, Kerala being a consumer state, we slowly had a bit of supplies coming from outside states also after 15. Then we started operating with necessary precautions like PPE kits, COVID test and all during the April, I mean the end of April. Then came the next challenge. We were facing the heat of this COVID economic crisis that COVID has created. People already were going into crisis, and they find it very difficult to get treated from private firms. So we had to cut short the cost. Automatically, when we start using PPE kits, we started making COVID test mandatory. The treatment cost goes high. So the next phase, I think with due course of time, the panic factor, the fear factor created by COVID has also gone down. Though the number of cases were on a high, the fear factor has gone down. So the people in the second phase started coming to OPDs and hospitals, especially the small centers, rather than the corporates where they'll be a bit more crowded, and multi-specialty centers, they will have to encourage fever patients, immunocompromised patients, cancer patients. So compared to them, we had an added advantage that we only had to cater orthopedic patients alone. We don't have to treat any fever cases. So that was an advantage, and that has created a bit of confidence among the public that we can courageously come here without getting exposed to COVID. And so if you ask me the current scenario, even now we are following the same protocol, and we have stopped using PPE kits because it is adding almost 30 to 35,000 to the patient's bill, which is becoming a bit of concern for every patient. So what we are doing currently following right now is we are doing COVID tests for all the patients who are posted for surgery. Ours is a joint center where most 90% of cases are elective cases. So we do a COVID test for all the patients whom we are operating. And for the OPD department, we are still screening them based on the pro we have right from the reception. They'll ask for the area from where they are coming, whether they have symptoms, and then they will have a thermal screening to rule out whether they are having a high temperature or not. And then they'll be in the OPD, they'll be spaced within a gap of 2 seats, they'll be made to sit in like that. And we have stopped using air conditioners, especially in OPD departments, to decrease the transmission. And I must say now, though the number of cases are going high, we are getting used to that COVID wave. So that is the current situation.
Okay. Yes. You want to say something, doctor?
No.
Okay, fine.
Yeah.
Doctor, thank you, Dr. Krishna, for giving the details. And you have mentioned that how all of a sudden when the lockdown was imposed, it was a very, very difficult situation for you, for your staff, and for the patients. And gradually when you understood what is the implications of the COVID, because initially nobody, including the doctors and the staff, were not aware what the COVID-19 is. And once you started understanding, and then after the relaxations, the fear psychosis also gone down among the patients, and they started coming to your place. And the thing is, which you have also mentioned, that initially the government wanted to put 50% of the beds only for the COVID. Now, according to you, when the 20-bedded hospital, if 10 beds are for COVID, then how the other patients would like to come for the surgery or the knee replacement or the joint replacement? And then you have mentioned about that how now because of the COVID-19 impact is not that much in Kerala, and you have stopped using the PPE kits in surgery, but OPD, whatsoever things you are doing, that you are doing, but you have made it compulsory for all the patients for the COVID test, so that you will come to know whether the patient is suffering from COVID or not, and then only you are doing the surgery of that patient. Now, now I would like to go to our panelist, Dr. Bhargav. Dr. Bhargav, you have mentioned about everything, and you have heard everyone about how they are, the nursing homes are facing lots of problems because due to the lockdown, like Dr. Goel has mentioned, that patients are coming which are not of those line which they are dealing, like they are in ortho and gynecs, but the patients of other diseases are also coming. Now, my question to you is, do you foresee legal issues from patients who are denied treatment or become COVID positive during hospital stay? Dr. Bhargava, please. Unmute, please unmute. Yes.
So as Dr. Anup Krishna mentioned that, for as far as patients who are taken for surgery, we are checking them for their COVID status, and just a couple of days before they are to be operated as far as the elective surgeries are concerned. But if there is any patient who is COVID positive, then the government has already in Maharashtra passed the rule that that patient has to be operated only in COVID designated operation theaters. So that is so that there is no further spread that can take place to the other places. The other thing I would like to also mention is he mentioned that 50% of the beds were taken, the government declared that they should be reserved only for COVID. So in Mumbai, the government, because we were totally overwhelmed by the number of cases that were there, so the government actually declared that even the smaller nursing homes, so even if you had 10 beds in ICU, they were taking over 80% of the beds were designated for COVID patients only. So with the result that if only 20% of the beds one could use for other purposes, the patients, obviously, those beds would not be occupied at all. So that would add to the problems that the nursing homes were facing. Coming to your question, as far as the legal status is concerned, now, right in the beginning, as far as the ENT Association is concerned, we came out with the guidelines, and we also came out with a consent form that the moment the patient enters into the OPD, of course, a lot of screening is taking place. We had tried to ensure that patients come only by appointment. When they come, they are screened with the infrared thermometer, and they sign a consent saying that they are the hospital is not in any ways liable if that patient develops a COVID infection. because there is no way that we can come to know from where the patient could have contracted that. So that the hospital or the healthcare facility which the patient is going to cannot be held liable for this particular thing. So I don't foresee any problem from that point of view, because yes, the patients are signing consent that they know fully well when they come here that there is a possibility, and also there is no way that you can find out from where the infection has finally come to the patient. So I don't see any really major problem as far as this is concerned.
Thank you, Dr. Bhargav. As you have mentioned that there is no such problem because if the patient has to sign the consent, and you also said that we take all the precautions whatsoever. But in Mumbai only, initially the media reports were about 8 major corporate hospitals were sealed because some patient and the staff were found positive. At that phase was earlier phase in I think the first period of the lockdown. Yes. But I am sure now the guidelines have changed. So now there is a relaxation. It's a good move because after all the hospitals, nursing homes and the doctors are doing their duty. They are doing their duty. They are not aware the patient who is coming there, whether he's a COVID positive or not, whether he's a carrier or not. But yes, whatsoever checking they can do, and they are getting the consent forms, etc. signed. So there should not be a problem in future also. That is a good point which you have mentioned.
Also, this is a new disease. So it's an evolving disease. And we do not know right from the beginning how things are progressing, etc. And now at least we have, in India, at least we have about 4 months of knowledge as to how this disease is progressing. So the guidelines are changing. I agree with that, and one cannot blame the authorities for changing the guidelines, because every time you find newer and newer evidence, data coming up, and that is why things are getting modified. And when you mentioned, yes, initially the rule was, at least in Mumbai or Maharashtra, that if you find that there are COVID positive staff, then they were completely sealing the hospitals. But they very soon realized that if that kind of a trend happens, then you will be depleting an already depleted healthcare system, and that will burden the other places far much more than what it is required. So that part has been understood by the authorities, and now better sense has prevailed there. Yeah.
Okay, Dr. Bhargav, you have mentioned very clearly that it's an evolving disease because nobody knows about this disease earlier, and the authorities, especially in Maharashtra, is doing a nice job by changing the guidelines. And initially, yes, there were problems, but now they have changed the guidelines, because initially even in UP, in Agra and other places, I think some hospitals were sealed because of this reason. But now I am sure that everywhere in India, they are not following this thing. Now my question to Dr. Goyal is, Dr. Goyal, in this COVID period, how do you maintain morale of your staff? Because see, after all, as Dr. Jain mentioned that the nursing home is the backbone of the healthcare, but the staff is the backbone of the nursing home or the hospital. So how you are maintaining their morale, because it's very difficult, especially in a tier 2 cities like Mathura, where the staff is coming from nearby places or the villages, to keep them high, because if you recall the incidents which were reported in media, the doctors, the nursing staffs were not at all welcomed in the bigger cities like Mumbai, etc. And they were not allowed to enter in the society. And afterwards, when the government of India and the state governments pursued it, and they have come out this thing that the doctors or the healthcare workers are the real warrior, corona warriors. So then the things have changed. But especially in the city like Mathura, where the people are coming from nearby villages or even from the city, how you are keeping their morale high and see to it that they should not be barred to come to your nursing home. Dr. Goyal, please.
Thank you, sir. Sir, I would say this is one of the silver lining in this COVID era. We, when the lockdown was enforced, we ensured that each and every of our staff is properly trained. Some of the staff wanted to go, did not want to come to hospital. So we told them that they will be given 1 month paid leave. We told them very openly that you will be given your full salary, even if you come or you do not come. The staff who were coming to us, we gave them extra incentive so that they work. and regularly on a 3 to 4 days interval, we used to train them about use of PPE, use of masks, sanitizers. So like in NABH, it is mandatory to conduct some safety drills, some training drills. Now, because of this COVID era, we had to do this. So it became sort of intermingled that we were doing it for ourselves for NABH, and it got converted into COVID drills. So in that way, we trained our staff. We told them how to use PPE, gloves, masks, etc. We told them all about disinfection protocol, like use of hypochlorite and all that. Then I told you about allowances and incentives and salary. Then adherence to quality norms, which were initially only literary and only on papers, but now since we have to do those in practical terms. So these were some of the things which we did with our staff to encourage them.
Okay, thank you, Dr. Goel, for giving a very good suggestion, or rather you said that what you have done is that you have given the incentives those who are attending the duty. Yes, Dr. Bhargav, you want to say something?
So I wanted to just add that, very recently the government also came up with a Mediclaim policy. In fact, the Kavach policy for our healthcare staff. So this is something, and particularly, so they are worried that they themselves may develop a COVID infection and how they will be able to afford the treatment. So there is the insurance, the IRDA has come up with all these, recent, I think it was on the 10th of July, that with very, very reasonable premiums for 6 months, 9 months cover for healthcare staff, because the earlier policy was actually going to charge double the amount that a normal person would have to pay as premium. Whereas this particular, so that is also something that I have done for my staff, where I have got the policy for them, so that, if by chance they develop an infection and they need to be hospitalized somewhere else, the insurance will bear their expenses.
Okay, thank you, Dr. Bhargava, for saying that now the insurance companies have come out with a Kavach scheme where you can insure your staff, the nursing homes or the hospital staff, on a very, very reasonable premium, and so that they can be covered for 6 months and 9 months. So staff will not have to think that if tomorrow they will become COVID positive, how they are going to bear the cost. And what Dr. Goel has also mentioned, that because of they have that accredited by the agency, they have to keep all the drills and they have to tell everyone about the social distancing and wearing masks, etc. But the idea which he has given is a correct thing, that you have to give some incentives in tier 2 cities. But I was told, I don't know whether that's correct or not, which Dr. Bhargav can vouch for it, that the state governments of many states are engaging the doctors who are just passed out from MBBS at the rate of 300 rupees per day. And when they are going to be quarantined for 14 days, there is no payment. I don't know whether it is correct or not, but if it is correct, then it is not a good idea, because today, even a minimum wages for a casual worker is approximately 500 rupees, which people are paying. And if a doctor whom we treat as a god in this, at least at right now, and we have clapped for them and we have showered the flowers on them, if they have been given so much less amount, I think the government, whether it's any government, state government or central government, should think, after all, they are doing their duty from the front. We are sitting in our homes and we are just talking, but the doctors are the main warriors. What you say, that you want to add something in, Dr. Bhargav, in that?
Unfortunately, to the best of my knowledge, this is true, that besides the salary that the healthcare, the resident doctors particularly, who are at the front line in all the public hospitals, besides their salary, they are being given only 300 rupees additional incentive, and the days that they are off duty, that is deducted if they, for some reason, develop an infection and get quarantined. I am told that that period also is considered as non-performance of duty. I think this is something that needs to be taken up. It is very unfortunate.
So I'm sure that Dr. Bhargav, being the president of ENT Association, at least you can move so the government can change. After all, government is listening the suggestions. As you have mentioned earlier, that's something which is a new thing. So the government has to be given a proper suggestion, which you can suggest to them from association point of view, and on behalf of association, definitely the government of the day will definitely consider it. Now, my question to Dr. Anup Krishna is, Dr. Anup, since overall work has been stopped or reduced, how do you manage to sustain financially?
See, that's what I told you. In the beginning phase, when the strict lockdown, the first phase of lockdown was introduced, we didn't work at all. And then the first question was, gradually we started feeling the heat of the economic crisis, that we how to pay the staff at the end of the month if we are not working. And so right now it's like, I think in Kerala the situation is not as worse as in Mumbai or in the other states. So that is a good thing. So right now we are resuming almost 70 to 80% of our works with necessary precautions. That is how, I felt that was the only way out of this. Because we don't have any long-term plans, and this doesn't seem to be ending, and we don't have any clear-cut plans for coming out of COVID as of now. And the numbers are increasing on one side. So one thing is we have to get used to this. The fear factor has to come down surely. And see, with the restrictions, we have to keep on working, and we have to go back to the pre-COVID phase of work as early as possible. That is the only way out, and that is what we are doing now. And as I told you, we are almost back to normal, almost 80% back to normal now.
Okay, thank you, Dr. Krishna, for saying that almost 80% you have back to the normal. And you said that Kerala, because yes, Kerala is a state which is not having that many cases which other states are facing. And you say now, because of that, that financial burden is not that much, or the constraint is not that much. Yes, Dr. Bhargav, yes, you want to say something, then I will ask a question to you. Yes, Dr. Bhargav.
No, so, even in Mumbai, for that matter, in a smaller nursing home setup where the total salary may not be as large as in some hospitals. So in my hospital also, the staff was given the full salary right throughout, whether they reported for duty or they did not. But if, the scenario in Kerala is different, there are far lesser number of people. Here in Mumbai, we still have to date 85,000 people who have been infected with the disease, and the numbers are probably plateauing. So if this whole scenario continues for another few months or even 6 months, in certain smaller setups, there can be even an issue of solvency. Because how long can you sustain with 85% or 75% reduction in revenue and your expenses continue? So it is something that we will have to see over the next few months.
Okay. Now my question to you is, yes, you said Dr. Bhargav has very clearly added that if this will continue for next 3-4 months, then the question of solvency will be there, because it's not possible to sustain the overhead expenses and with less revenue. Now, Dr. Bhargav, you are in healthcare for a long time. What is the role of private nursing homes in managing COVID patients?
So as I mentioned that today we have to look at the COVID situation in two things. One is the COVID positive, and there are so many other diseases also that the patients are going to be suffering. So the government here, of course, when it got overwhelmed, they passed out the resolution that 80% of the beds will be taken over by the managements, by the government for maintaining that, because see, here the question was that there were far too many patients. And now that we find that the number of patients are gradually, I would not say declining, but at least some kind of a plateau has formed in Mumbai. So we find that yes, now, and also to the credit of the government, they increased the number of options available. So we have huge centers over here who can now cater to COVID positive patients, huge setups. whether it be in BKC, whether in Nesco, with so many places. So with the result that now what can be really done is we have two setups. We can have the ones that are catering to COVID patients, and simultaneously the other setups that will be catering to non-COVID, so that the other ailments also can be catered to, and the government can look at these new setups that they have made to cater only for COVID, and the existing setups that are already there and functioning very well so far, to then take over the burden of the remaining healthcare system that is right now, kind of crumbling. So while we focus our energies on controlling transmission, controlling and curbing the morbidity, the other ailments should not take a back seat. We should continue to help our patients who are otherwise suffering. This is what I feel.
Okay, thank you, Dr. Bhargava. According to you, because the Mumbai, at least in Mumbai, the increment has of the patients, this COVID-19 has just come on a plateau. Now it's not increasing the way it was increasing earlier, and now the government has also increased the bed capacities and the facilities for treating the COVID patients and even the non-COVID patients. So according to you, the nursing homes are playing positive roles even for treating the non-COVID patients in their facilities. Now I would like to ask Dr. Goyal. Dr. Goyal, there are media reports which comes almost every week or twice a week or thrice a week, which attributes high cost to a private healthcare. Is it true? Many times it happens there is somebody's bill is flashed on the WhatsApp or even on the national news that so and so hospital has charged so many lakhs of rupees for treating 8 days or 9 days. What is your say about this?
Sir, if those, I have also seen those WhatsApps, I have also seen those news, and I'm assuming that those news are true. If those news are true, and actually if the big hospitals or some corporate hospitals are actually charging in lakhs for a patient to just be isolated and given what they presume is COVID treatment, and for that thing, if they are charging lakhs of rupees from their patient, I will not say it is a healthy practice, sir. We know in today's time, medical profession is being demeaned. It does not command the respect it used earlier. So these things are the only causes of demeaning of this profession. If we know as of now there is no treatment for corona, we are giving just supportive and symptomatic treatment for non-symptomatic patients. For those patients, just for isolating them, if we are actually charging them lakhs of rupees, then obviously what will public say about us? What will administration think about us? So we need to have a serious rethink about our policies in making such huge amount of bills, because in long run this will be very detrimental to our medical profession.
Thank you, Dr. Goyal. What you have said is a very realistic thing, because according to you, the corporate hospitals, or few, I will not say all, or some big hospitals, they are charging only to keep the patients, because there is no definite treatment as far as the corona is concerned, and they are just giving only those medicines or the supportive things which anyone in any hospital can be given. And if they are charging lakhs of rupees or even a lakh of rupees per day, which turns out to be sometimes 9 lakhs or 10 lakhs or even more, it is very unfortunate. And according to you, what respect earlier the doctors or the nursing home, the hospitals used to get, now it is not there. Although I differ, now we have clapped for you all. We have showered flowers on all of you. So you cannot say that we are not doing. Yes, we know that the earlier people were doing it from heart. Now whether they are from heart or doing heart from heart or not, that we can't say. But yes, you have made one very good point, is that people should not, or the doctors or the big hospitals should not try to do this practice for charging so much money. It will give a bad name to the medical profession, doctors, nursing homes and hospitals also. Now I would like to ask Dr. Anup Krishna. Dr. Krishna, in what happens if one of your staff member, I am just saying, I am asking you, it's a presumption, it can be in any of the hospital. If any of your staff members become COVID positive, what is going to happen? What you will be doing? Earlier, as Dr. Bhargava has also endorsed, that earlier they used to seal the hospital. But suppose in your case, in your small setup in a nursing home, if a staff found positive, what actions you are going to take and how the other staff will react on that? Dr. Anup Krishna, please.
I think actually we don't have any definite norms for that, because ours is a small center. If one staff get affected, that means the particular person should be, everybody will be exposed to that particular staff, because since it's a small setup, we all will have to go for a quarantine period surely until we test negative. And so that is the problem with small centers. If it is a large multi-specialty hospital where you have different sectors and one staff from a particular department becomes positive, then only the ones who are in contact with particular staff has to go in for a quarantine period. But on the contrary, if you take a small setup, then we all see every day. There is nothing like I don't meet my staff, once in a while or something. So we all meet every day, the patients, the rest of the staff who comes in contact with, everybody should go in for quarantine. And as per my knowledge, there is no definitive period. The government norms are like we should go in for quarantine for 14 days. But the actual fact is that at the end of 14 days, we are supposed to do a COVID testing. And the COVID testing false negative is almost 30%. So even if the symptoms persist and you test negative, again, you will have to wait for another 7 days and to recheck your COVID status to resume back to work. I don't think there is any other go. If one of the staffs tests positive, then that is it, done. We should go in for a quarantine for next 2 to 3 weeks.
Yeah, Dr. Goel, you would like to add?
Sir, I'd like to tell my experience in this. Our one staff did come positive on government did random sampling. Our one staff did come positive. So the report came 3 days later. So as soon as the report came in the CMO office, they told us to isolate that staff in our isolation room. We isolated that staff. The ambulance came. They took the staff to the L1 center, and then we were told to close our hospital for 1 day, do thorough sanitization and fumigation 3 times or 4 times. We did that, but out of our own precaution and because of the public perception, we closed our hospital for 7 days. We were told to close it for 1 day only, but we ourselves closed it for 7 days. And our staff was taken to their L1 center, and there he was treated or kept in isolation. He was kept there for 14 to 15 days. Then he was brought back, and then he was in 7 days quarantine at home. So, and now he has joined our hospital again.
Thank you, Dr. Goel. You have mentioned, you want to say something, Dr. Krishna?
I have a doubt to Dr. Goel. See, no, I don't know. As in Kerala, we don't have any specific instructions from the government if such a scenario occurs. So what is because now we know that COVID can spread, even it is an airborne disease, it can stay in the air for almost 8 hours. So what is the rationale for, 7 days, a 1 day shutdown? How effective can it be, and what is the rationale for that?
I cannot tell you that rationale.
So what Dr. Goel said is that once the patient was found positive, they have to send as per the government direction. But what Dr. Krishna said, that is a very alarming thing. He says that because the nursing homes are very small, 10 bedded, 20 bedded, 50 bedded, where the interaction with the staff almost with everyone is possible and is going to happen. While in big corporate hospitals, where the staffs are so many that every doctor is not going to meet every staff every day. So the condition is like what Dr. Krishna has raised about Dr. Goel, when one staff was found positive, what about the other staff, whether they were not sent for the quarantine for 14 days?
No, sir. Sir, they did COVID testing for all the staff which he had come in contact with, and all the staff, they were found negative. 2 or 3 staff which were in close contact with that patient, we told those staff to go in home quarantine for 14 days.
Okay. Thank you, Dr. Goel. Now, in the last round, I would like to ask Dr. Bhargav, what are your suggestions to the government and advice to public? Dr. Bhargav, please. Please unmute. Yeah.
Yes, yes. So, suggestion to the government, of course, is to continue to keep the focus on testing, tracing, and isolating, so that we are at least able to control the spread of the disease, because it is only by these measures that we will be able to overcome this problem, and continue to do it very diligently, even if the numbers are increasing, because we know for sure that till the vaccine arrives, if at all and when, the only measures that we have are this testing and isolation of the patients. Of course, we have got better and better medication now, which will reduce the hospitalization stay. We are trying to reduce the numbers of mortality. So continue to do that, but at the same time also maintain a little bit of a soft attitudes towards the other healthcare providers, and do not come up with any kind of, if I may use the word, draconian rules as far as the working and functioning of the smaller setups are concerned, because we are providing a huge a backbone to the entire healthcare system. So we know what the limitations would be, but there are certain areas where some little bit of leeway should be given to the smaller setups. As far as the public is concerned, again the same thing, that one should not let the guard down, continue to because the only way that you can contain the spread of this virus is by the physical distancing. I won't call it social distancing, because it should be physical distancing and not social, so that your emotional impact is not there on the people. Continue to wear your masks in public. Continue to make the same hygiene precautions, whether it be cough or sneeze hygiene. Continue to make sure that you wash your hands regularly or sanitize them, so that you do not land up catching the infection. Also, do not stop your other medications that you are taking, thinking that, I'm at home and nothing is going to happen to me. So continue to take all your medicines that you are taking under guidance of the doctors. Also, do not neglect and ignore your other ailments, because they also are equally important. And we are hearing of patients who have developed strokes or even infarcts, and even onco patients are refusing to go to hospital to take treatment because of the fear of getting an infection in a hospital. Please do not do that, because we have now found that the mortality as far as this disease is concerned is very, very small numbers, and we should not land up with other major problems and mortality because of our pre-existing illnesses. Please do not ignore that.
Okay, thank you, Dr. Bhargava, for giving the advice to the government that they should be lenient to the health workers. No draconian type of laws or the rules or the guidelines should come, so that the moral of the healthcare workers will go down. And you have also advised to the government that there is no other way. We have to do the testing, as WHO has initially said, and according to you, testing and the tracking and the tracing and the isolation. And you have given advice to the public that please do the physical distancing, not the social, only the physical. Emotionally, you should be attached with everyone, but physically you should distance. Hand hygiene and wearing mask is compulsory. Thank you, Dr. Bhargava, for giving such a good suggestions. I'm sure the government will take a note of it. Now I would like to go to Dr. Goyal. Dr. Goyal, your advice to the government and suggestions, or the suggestions to the government and advice to the public.
So first of all, there should be a national coherent strategy to deal with this COVID situation. It should not be like that in some state there is one strategy, in another state there is another strategy. In one state only, there's one strategy in Agra, there's another strategy in Mathura. So there should be one strategy, so that everybody is aware of it, and it can be strictly implemented. So then I would say, I have seen CMO office guys and doctors working very hard during this time. So I do appreciate them. They are really doing a fabulous and fantastic and very hard work nowadays. So it should continue. There should be, and the coordination between IMA, private doctors, private nursing homes, and CMO office at this time right now is very good. Initially, we did not used to know their names. We do not know who. We only used to know who the CMO is and not ACMOs and deputy CMOs. But now, at this time, because of the increased coordination, we know them by their names. We have their numbers with us. We can ask them. We call them at any problem. Suppose we have to send somebody to COVID testing, we ask them. They help us, and this thing should continue, so that in later era also there is good coordination between private doctors and government doctors and CMO and administration. Then, sir, they are very much sympathetic towards our problem. This time, this should continue.
Okay. Thank you, Dr. Goyal, for giving two things. First thing you have mentioned about that there should be a national strategy or national policy for the entire nation. The same policy, it should not be state-wise. And you also said even in the state, there is a different policies for the cities or the district-wise, which is not correct. According to you, it should be a same for every state, every district, or in the entire country. And secondly, you said that in the initial phase, you have not got the cooperation from the CMO, that is the Chief Medical Officer of a district, and their team. But now they are giving full cooperation, and you want that this cooperation should continue in the same way what they are giving now. Thank you, Dr. Goyal, for giving your valuable suggestions. Now, Dr. Anup Krishna, please, what are your suggestions to the government and advice to the public?
One matter of concern right now is, as the other, Dr. Samir and Dr. Goyal was saying, the cost of treatment. The added cost part comes from the COVID-related supplies, like the PPE kits, the additional testing we have to do. That adds on to the cost of the treatment. So right now we have to spend, the patient has to spend 4,500 rupees for getting the COVID test done. So my first suggestion will be to cut short the price so that we can give the same treatment to the patient at the same cost that we were giving the pre-COVID times. So the cost is a one concern. And then another thing will be a relaxation of GST for especially COVID-related supplies like the PPE kits and all. And faster payment also from the government schemes. So the insurance companies never worked at all during the high COVID period and the extreme lockdown situation. Now they have started working, and it would be great if the government takes steps for making the payments from the government schemes a bit more faster. And then the testing, the waiting period after test, even if for emergency case we have to get the COVID test done mandatorily, and the patient will be made to meet almost 24 hours to 2 days. So it will be great if they can provide sufficient kits so that we can do the test a bit more fastly. We can get the test, because as Dr. Goyal was telling, the staff who was in suspect of COVID had to wait 3 days for getting the result. So within the 3 days, what if she was asymptomatic? What if she comes into contact with the number of people? So it will be great if the test results can come a bit more earlier. If the government starts providing more and more kits, then we can get it in a bit more shorter time. And now we have got strict lockdowns here in particular areas, because of which we are finding it difficult to get the implant supplies is at a problem. Because I am a surgeon, I am an orthopedic surgeon. We do need implants for doing surgeries. So implants has to come from other places because of the strict lockdowns in particular pockets of areas. It is a difficulty for us to get the implants. So it will be better if the government can issue special passes for healthcare professionals after proper testing, and so that they make sure that the supplies as well as implants are provided at the right time. And my suggestion will be, and whichever country who has successfully controlled COVID, if you see, they haven't gone for a strict lockdown. See, a 15 days lockdown is not going to control COVID completely. We need to continue this restriction for a longer period of time if we have to survive this. So I would say we need strict restrictions rather than complete lockdown. That will be more effective from my point of view.
Okay, thank you, Dr. Krishna. You have given so many advices. The first advice you have given is that the cost of the testing cost should be reduced, not 4,500. Yes, I think there was a media report that the test kit was developed indigenously for 600 some odd rupees. So I'm sure that once if it is effective, then immediately the government should take decision and reduce the thing. Then you have mentioned about the GST. Yes, this is a very good point, because at least on the PP kits, on anything which is related to medical thing, and especially for the COVID thing, no GST should be there for the time being, because this is a life-saving equipments, life-saving drugs which you people are using, and it should be treated under that category. And thirdly, you have mentioned about that because of the lockdown, many places you are not getting the supplies. The government, I think the government has already issued a notification wherever there is a lockdown that all the essential services they are allowing to move. But in case if there is a particular thing, you can raise this thing in a district level. I think you will get the permission. That is not a thing which can raise the you can raise, because in Karnataka also, I mean in Maharashtra, the government has already allowed all the essential items to move even during the lockdown. And last you have raised about the what was the point which you have raised the last so can you just
restrictions rather than complete lockdown? That was
you said that there should be a lockdown which other countries have done in a bigger way, not 15 days or so. Is it correct?
No, I meant to say that we need strict restrictions for a longer period than complete lockdown.
What do you mean by strict restriction? What is the difference between strict restriction and the lockdown?
Restriction means we have to continue using masks, we have to continue using sanitizers, and Dr. Samir said, I will also agree with that. We need physical distancing, and we have to stick on to that. Doesn't complete lockdown means all of a sudden you are not allowed to go out, you are not allowed to go for work, you are not allowed to go for office. That doesn't seem to be practical. How long can you sit at home without working?
Okay, so you are saying that the government should impose strictly about the physical distancing, wearing masks and others. Yes, many state government has already started putting fines, but this is not the entire responsibility of government. I think this is a civil society. We all are responsible for this, and I'm sure that this suggestion should go to the public at large, that we should, if we want to overcome this pandemic, we have to do three things. One is the physical distancing, as Dr. Bhargava said. Secondly is the hand hygiene, and third is the wearing the mask, which is very, very much important. So, so you have seen today the medical fraternity, especially the owners of the nursing homes, small hospitals, what difficulties they are facing, and what are the cooperation they are getting, and from the government as well as from the public. This is the real story which we wanted to bring to you, because we want that they can raise their voice. They should be provided a platform where they can tell what are the realities from their side. And one thing which they have raised, which is really for all of us, for all of you, that we must maintain our physical distancing, hand hygiene, as well as the wearing the mask. Number two, we must regard them, give them the respect. We should not fight with them. After all, they are serving us. They are working day and night, and they are saving us. And there is a report from IMA, national president, and it says that 8% of the doctors have already lost their lives who were tested positive. So one can imagine that they are giving the lives for all of us. We should salute them. We should really, from our heart, we should clap for them. From our heart, we should shower the flowers to them, not only just to show them. Today's program, which has been live telecasted on V4 News, Global TV, News Karnataka, News Gaon Se, and Malnadu TV, as well as it was shown live on Facebook and YouTube. And we will be bringing such types of programs every day. Keep logging at 11 a.m. every day. Thank you very much, Dr. Samir Bhargava. Thank you very much, Dr. Praveen Goyal. Thank you very much, Dr. Anup Krishna. And thank you very much, Dr. Deepak Jain, for joining and enlightening all of us about the problems and about the services which the nursing homes and the small hospitals are giving to the society and to the nation. Thank you all for joining us.